Anya has been living with primary sclerosing cholangitis for 20 years. And this was not her first diagnosis.
Seit 1995
I have had chronic inflammatory bowel disease, or ulcerative colitis, since 1995. Then in 2001, the PSC diagnosis came. Since then, I've been living with the disease. I have ERCP examinations every now and then, and I'm actually doing quite well.
It is important to diagnose the disease, especially in patients with inflammatory bowel disease, because we can treat certain parts of the disease and we can detect complications early in order to be able to handle these complications in a proper way for our patients.
The diagnosis primary sclerosing cholangitis, or PSC, is made in 10 to 20 out of every 100,000 people, with a male to female ratio of 3 to 2. In 60 to 80% of cases, there is an association with inflammatory bowel disease, or IBD, which most often affects the large bowel. In the course, inflammation and scarring of bile ducts occur, resulting in constrictions, which must be treated. Anya had been living with her chronic bowel inflammation for 6 years. It was under control. Then she was diagnosed with PSC, but that came out of the blue. I was diagnosed with PSC when I was 34, I think, and I was admitted to the hospital because I had thoracic complaints on the left side. Then they took blood and found elevated liver enzymes, and then the doctor did an ERCP. That's when the diagnosis of PSC was made. So it was not the PSC symptoms that made me go to hospital, because I didn't have any. In the early stages of PSC, the patients are most often asymptomatic. In later stages, once the bile ducts develop strictures, pruritus, jaundice or abdominal pain can develop. Symptoms like these may lead to the diagnosis of PSC. In addition, disease complications can arise. For example, episodes of bacterial cholangitis requiring antibiotic treatment. It may present with fever or malaise, but sometimes it may just present with an elevation of inflammation markers and increased liver enzymes in the blood. Anya was diagnosed with high liver enzymes, which were discovered by chance in the hospital. Increased liver enzymes are always significant. In Anya's case, mainly the enzymes gamma-GT and alkaline phosphatase were elevated. Elevation of these enzymes is a strong sign of damage to the bile ducts.
Die Leberwerte waren noch nicht so dramatisch hoch.
The liver enzymes were not yet so dramatically high, so everything was still okay. And they got higher and higher over the years. But still, I did not have any symptoms. And at some point, now about 10 years ago, itchiness started. After having bad experiences elsewhere, Anya sought out a specialized center for rare liver diseases on her own, the University Medical Center Hamburg. She went through a thorough examination. Laboratory values are the first step in the diagnosis of PSC. Liver enzymes, which indicate damage to the bile ducts, called ALP and gamma-GT, are often elevated. These laboratory tests can give an indication, but they cannot determine the diagnosis. This is confirmed by magnetic resonance examination of the bile ducts, called magnetic resonance cholangiography, abbreviated MRC. Additionally, an ultrasound scan is performed to evaluate the spleen, liver and gallbladder. MRC is considered the most important investigation in PSC because in this procedure, the ducts of the pancreas are also visualized. This method is often called MRCP. It may show irregular bile ducts with single or multiple strictures and dilatations of the bile ducts as a sign of the disease. In Anya's case, the examinations had a clear result. The existing diagnosis of PSC was confirmed. She had to accept the prognosis.
Ich habe mir das natürlich alles durchgelesen.
At the time the diagnosis was made, I read through all of the information, of course. And of course the fact that this can also have a fatal end. I also read the information on liver transplantation and how fast the course of disease can be or how slow it can be. I was already aware of all that. And then when it got worse and worse with the itching, I did start to worry.
Habe ich mir schon Gedanken gemacht.
To date, there's no cure for this disease. We can treat complications if there are complications such as bacterial inflammation, infection of the bile ducts. We can treat the symptoms in a way that the quality of life is improved. And, which is very important in PSC, we can detect early on potential complications of disease. That is, early stages of malignancy that can lead to a cure of a growing initial cancer.
There are several options for the therapy of PSC. In case of bacterial cholangitis, antibiotics are crucial.
The most relevant complications of this disease are the development of bacterial cholangitis, which is a bacterial infection of the bile ducts, which can develop into a medical emergency and which is characterized by fever and nausea, abdominal pain, and an increase in your liver enzymes when tested by your physician. So, in case of unclear fever, please consult your physician, and the bacterial cholangitis should be excluded.
A bile acid, called ursodeoxycholic acid, is prescribed frequently to PSC patients, although this is not evidence-based therapy.
Many patients receive urso, which is a protective bile acid, which frequently lowers liver enzymes, but for which we do not know for sure that it improves the course of disease. There are several clinical studies ongoing which investigate new compounds and new drugs for which we hope that the course of disease will be improved in the future.
In case of high-grade strictures of the bile ducts and associated complications, doctors perform an endoscopic procedure called endoscopic retrograde cholangiopancreatography, or ERCP. In this procedure, the doctors advance an endoscope through the mouth to where the bile pancreatic duct joins the duodenum. They then insert a probe into the bile ducts. In this way, the bile ducts can be visualized and treated.
With this technique, we can access the bile ducts and dilate strictures. And in case of stones, we can remove stones, and we can also take small pieces of tissue from the bile ducts in order to investigate those pieces under the microscope in order to exclude malignancy.
If PSC progresses and limits liver function too much, liver transplantation may be considered. This treatment has an excellent outcome in PSC, with a 5-year survival rate of above 80 to 85%. Anja has had numerous ERCP procedures over the years.
Wenn so eine ERCP ansteht, ich meine, ich weiß ja,
When an
was da
ERCP like this comes up, I mean, I know what to expect. I don't know how many I've had now. Over 10 for sure. In the early days, it was probably 2 or 3 a year, and now there is mostly a 2-year break between them. And yeah, I don't really notice anything anymore, not from the ERCP. When I wake up, I always have severe pain, mostly severe pain in the abdomen, in the upper abdomen. But then I get painkillers, and it's okay again.
Und dann ist das auch gut.
And there is another procedure she has to undergo regularly, colonoscopy, an examination of the large intestine. This can detect and remove polyps, changes in the intestinal mucosa that can become malignant. Because the risk is increased in people with PSC and inflammatory bowel disease, colonoscopy is an important procedure.
We recommend a yearly colonoscopy from the time point of diagnosing PSC and colitis. If you adhere to this recommendation, it has been shown that the mortality from colorectal cancer can be significantly reduced.
For surveillance purposes, in addition to the colonoscopies, MRCP is recommended yearly to exclude malignancy and to look for new strictures of the bile ducts. Ultrasound exams should be performed every 6 to 12 months, where doctors also look at the gallbladder to rule out polyps. And patients are advised to have bone densitometry at least once at the time of PSC diagnosis and afterwards, as guided by the results of the examination. Anya has gotten used to the regular examinations. They have become routine. Her main problem is the pruritus that plagues her every now and then. Pruritus is a symptom of PSC itself, but it is also induced by the drug Urso that she takes.
Das war schlimm.
That was bad. I had dream liver enzyme results thanks to the Urso last year. They were as good as they had been 10 or 15 years ago, but I wasn't doing so well in terms of the itching. I told my doctor during my last consultation at the beginning of the year, and now we have reduced the Urso somewhat and increased the itch-inhibiting agent, so to speak. And now I can live with it, and quite well actually.
Ja, juckhemmende Mittel sozusagen erhöht und jetzt kann ich damit ganz gut leben.
Problems that can occur during the course of PSC, as well as the side effects of medications, can be solved with experience.
PSC is a rare disease, and I think it is important that your treating physician has experience in treating this disease. There are several decisions to be taken together with the patient that can only be taken in a proper way by an experienced and ideally interdisciplinary team. The European Reference Network on Rare Hepatological Diseases, so rare liver diseases, has been formed within Europe to support the care of patients with rare liver diseases. And your treating physician is very welcome to address this network to get advice on the treatment and care of PSC.
She has doctors she can trust and with whom she can speak at any time. A curative therapy is not yet in sight, but that does not prevent Anya from living and working actively.
Mein Leben mit der PSC ist gut für mich.
I find my life with PSC good, but I also know that it is only so good because I have regular examinations and I am very closely monitored. I am treated with ERCPs. I also have regular MRIs or ultrasound. So medicine, as it is today, helps me immensely. According to the current state, it could go on like this.
Sonst weiß ich nicht, wie es mir heute gehen würde. Nach dem jetzigen Status quo könnte es so weitergehen.